Hey everybody, Dr. Deom here on another Eyecare Today. We are going to kind of spin up a little bit more information for you about Neurolens, the newest, hottest, and best treatment for patients who have really unresolved headache, other things going on that just have not been addressed otherwise. So boy, am I excited to talk to you about all of that. We have a special guest too, and we're gonna introduce him in just a second. Don't forget all of our beautiful locations. We're here on our specialty suite side of Hazleton Eye Specialists on the Airport Beltway, 281 Airport Beltway here in Hazel Township, PA. Beautiful location. We just went through a really awesome renovation, so stay tuned. Some really exciting things going to be coming with the renovation, so stay tuned. Watch our social media for some of those updates. You'll be seeing that coming out very, very soon. Hopefully it provides more efficiency and comfort for you. We have a large new waiting area, which is really very exciting, and we're happy to provide really just an absolutely state-of-the-art location right in the heart of Hazleton. Everybody likes to talk about Hazleton, but guess what? We love it, and we're investing heavily in it because we believe in it. Don't forget Stroudsburg Eye Specialists, right on Route 611 in Tannersville. Go to the outlets, get yourself some Polo Ralph Lauren, and go get yourself a fantastic eye exam. Dr. Karim Bellinger, Dr. Olzinski, and even Dr. Kislin goes to our office there in Stroudsburg and Tannersville. Newest location, Bangor Eye Specialists, really a beautiful area, area I was not completely familiar with, but we got Rosetto, Wind Gap, not far from, it's 20 minutes from Bethlehem and Easton, and so a really cute little area. 2 new doctors joining the practice here in a short period of time, which we're very excited to have, and we'll be sharing that information here with you all shortly. Nanticoke Eye Specialists, just an absolutely fantastic location with an even more fantastic doctor, Dr. Alexis Wylam, who is an absolute rock star, a specialist in contact lenses and also brain injury and dry eye, just really very passionate about the specialties in eye care. We really, sort of a blessing that this office is just getting going again. So that Dr. Wylam and the staff have a lot of time to spend with each and every patient, provide that individual level of care that you all love and respect. And last but certainly not least is the Skook. We absolutely love the Skook. I think of pierogies and made-at-home booze when I think of the Skook, and I also think of all the fantastic people that I've met there every Tuesday when I'm there. But Dr. Brendan Connors, Dr. Courtney McCall, and Dr. Akirta Saran are also there in our office, as well as Dr. Patel, our retina specialist. So check out one of our fantastic 5 locations today. And if you haven't met this guy, boy, are you missing out. This is Dr. Rob Dougherty. And Dr. Rob Dougherty, would you mind just reminding us about yourself a little bit?
Yeah.
Go ahead.
So I'm kind of native to northeastern PA. I grew up in Shavertown, went to school in the Wilkes-Barre area, and Holy Redeemer High School. I'm a graduate of the University of Scranton, went out to the Pennsylvania College of Optometry in Philadelphia for my optometry degree, and here I am back, really just excited about providing care for patients in the area that I grew up in. So really excited to do that and talk about Neurolens today.
Yeah. So I've you've been with the practice for a little while now, and every time, you know, I talk to a patient who's seen Dr. Dougherty, they're always like, that guy was so nice. You know, he's just so nice, you know, like that's what I always hear about you. He's so nice. And they do. They love him, and he really is so nice. He's got a great bedside manner. He's sharp as tacks, and you know, he's ready and able to see you and your whole family, all ages. So we're really excited that he's here in this office, and primarily in Hazleton. And you know, again, a good local guy, something we're so proud of, to bring local people back to the area. So he mentioned Neurolens, and hopefully you caught the last episode that we did on headaches and Neurolens, and I want to go back to that a little bit, because I said in the last show, headaches is one of the primary reasons that people come to get an eye exam. You know, it's kind of comes in two phases, I think. One are children who are experiencing headaches, and so you know, we'll hear it from the school nurse, we'll hear it from mom and dad, and sometimes little Johnny and little Susie can verbalize that they're experiencing headaches too. So Dr. Dougherty, what are some of the things that you do when you have a patient that comes in with mom and dad, and you know, let's say they're in elementary school and they're suffering from headaches? You know, hey, I brought little Johnny in today because they're having headaches. How do you approach that? What are some of the questions that you ask first?
Yeah, I mean, I think with anything, it's really important to just get a good history. You know, we want to know, when are they happening? How often are they happening? The severity, is there anything that's triggering them? And sometimes kids know way more than we think. So sometimes just sitting down and talking to them one-on-one with the parents in the room is comforting to them, because you're hearing them. And so what I always want to know is, you know, where are they coming from? What can we do to help? And obviously in the past we would do, you know, your best glasses prescription possible, and really help to alleviate a lot of those symptoms. But more and more we're finding that the glasses that we do now, while they're fixing the overall visual acuity and how well people are seeing, they're not addressing visual comfort most of the time. And so that's where our new technology here, I think, really comes into play, and allows us to address that in a way that's more than just surface level prescription.
So are you presenting Neurolens to children? Is that something that you think is appropriate and possible?
Yeah, as long as the child can understand the prompts, I think everyone is great on it. I think kids love it because it actually feels like a video game a little bit, but it gives us some really great information. And like I said, kids do know a lot than we do think, and they tend to do really well on it. And it gives us a lot of really useful information to help them, and help them be their best in school and sports in general and in life.
Yeah. You know, it's one of those things, and sometimes, you know, we'll look at little Johnny or little Susie, you know, little Johnny, are you telling the truth, you know, or what, are we just trying to get out of school or get out of gym class, or, you know, some of those things, and you try to dig through that, and sometimes you uncover some pretty serious stuff, you know, in addition to talking about the importance of good sleep and proper hydration and good diet. And unfortunately, you know, there's a lot of times where that stuff is not you know, taken care of. So on the other side of this break, we'll go into more information about headaches. Thank you. Hey everybody, welcome back to another fantastic episode of Eyecare Today. Here I am with Dr. Rob Dougherty, a Holy Redeemer grad, University of Scranton grad. He is, I mean, I just feel the Catholicism radiating off of this guy. He's fantastic. We love having him, and patients love him too. And if you're looking for a new eye doctor, you know, give us a call here at Hazleton Eye Specialists. Him and his lovely bride, who's a fantastic doctor, Dr. Alexis Wylam, are available in both of our Hazleton Eye Specialists and Nanticoke Eye Specialist locations. I'd love to serve you and your entire family. But today we're talking about not just headaches, but we were talking a little bit about headaches in children and how, it's often very difficult because there are so many factors, sleep, water consumption, diet, exercise, hormones play huge roles as well. And so I think, a lot of times, and I have friends who are pediatricians, I've spoken to them about this, and they say, yeah, if somebody comes in and they have headaches, it's one of the most common reasons pediatricians see patients for urgent appointments. They will say, don't even come until you get an eye exam. Go do that first. Get that off of the list. And so, like Dr. Dougherty was saying, what we would historically have done is do a really thorough history and exam, check vision, make sure we're seeing well. And as I said in a previous episode, good vision is food for the brain. So if we're giving the brain good food, then we would expect it to feel better, but it doesn't always. And that's where some of this missing link has been for eye care and the greater healthcare community, really for forever. Now, we have in our offices always kind of taken it one step further. We're really proud to have been an office who believes in, really looking at how the two eyes work together as a team. We do something called vision therapy. And vision therapy is a process by which we can do therapeutic exercise. That means we're telling you to do certain exercises with certain goals in mind that we're measuring with an outcome. That's a therapeutic exercise. And so we would do vision therapy to strengthen people's ability to move their eyes and control them with the goal of the two eyes working together as a team. But now we have a way to measure that really is worthy of 2025 and AI and everything else. So now we have that ability, and it's this beautiful headset right here. And so we put this headset on, and you'll see in the video here, kind of what the patient sees and what you would see. And it's really simple. It's only a couple of minutes, and it looks at how your eyes are measured compared to the distance and near. And so you've done it. What are your thoughts on the machine?
So I think it's actually really cool technology. So when you're in there, it talks you through everything. It's very straightforward, very clear with the instructions, and it's doing a lot of measurements all at once in ways that previously we either couldn't do or it took us a while to do. And at the end of it, it's going to ask you a symptom survey to ask, are you having headaches? Are you having eye strain at the computer, discomfort at the computer, neck pain, and some other symptoms? And it will tell you exactly why it believes you're having those, which, like Dr. Deom was alluding to here, basically just amounts to your eyes are not lining up the way they should. And at the end of that, basically we'll come into the room and initiate that discussion after we see the results. And it gives us a lot of information we previously did not have.
I like to think of the eye muscles having a tolerance. Mm-hmm. Okay? You have a tolerance. So our eyes and our eye muscles can take a lot. They work all day long. Just imagine using your hands and arms all day long, right? They'd eventually get tired, but your eye muscles, they work all day long and you barely ever feel them. But for some we do, and you hear that all the time. I feel tired at the end of the day. My eyes feel heavy at the end of the day. And so, that's where we're straining the tolerance that's built into our eye muscles. When that tolerance is used up, what happens? We see double. That doesn't happen very often. We got to really have a problem, for there to be double vision. And so historically with double vision, what would we do? What could we do if somebody was constantly seeing double vision?
Well, like you said, it would depend on the cause. So, historically, the easiest fix would be putting prism into the glasses.
Prism. What is prism?
So prism is basically a type of lens that bends the light a certain way in order to help move the light into a more comfortable viewing position.
Simple. So it's just something that we could put into your lenses to move the image to where your eye is. One eye's here, one eye's there. We could put prism in this eye to move the image to where that eye is so you still see what's in front of you and not what's in front of you and what's on the side of you. So you're not having symptoms. Good, clear vision is good for the brain. So if I'm seeing something here and something over here, my brain is very unhappy. The problem with prism was what? what kind of issues would we run into over time with Prism?
For the most part, it was a lot of people just accepting more and more of it. And so people who would start out at a very small amount would suddenly want more and more every year they would come in, and suddenly the glasses are getting thicker and thicker, harder to make, and harder for the patient to use.
Exactly. And so we are very proud of the fact that we're very comfortable and confident in our ability to prescribe Prism. It's something that a lot of eye doctors sort of shy away from, and something that we sort of lean into because it is a really important thing for people who are suffering from traumatic brain injury and stroke and other vestibular diseases that are often undiagnosed and unable to be treated. And so we've really leaned into Prism prescribing. However, we really reserve it for those most severe cases where there are no other options. And therapy, the vision therapy that we talked about, has sort of failed. And so, you know, the idea that Neurolens is now providing a different type of prism, this contoured prism, that does not do that. It does the exact opposite. It can strengthen or even help, you know, maybe in the future reduce the amount of prism that we need. It was really an earth-shattering idea. And so, you know, when we come back, we're going to talk not only about how Neurolens and contoured prism could help to reduce headaches, but also how it could help to reduce things that are very common and problems for many of us, like neck pain, temporal mandibular joint pain, even pain from dry eye, believe it or not. Something, you know, we talk about almost every patient interaction and many times on the show. So stay tuned, and we'll be right back for our last segment. Hey everybody, welcome back to another fantastic episode of Eyecare Today. I am joined by my fellow doctor in crime, Dr. Rob Dougherty. Where exactly are you from?
So originally from like Shavertown out by Dallas.
Okay, I was gonna say Hanover, but I think I'm thinking of...
That's my wife, yeah.
Dr. Wylam. And so, okay, he's a back mountain guy from La-Ti-Da. Just kidding. Yeah, he's a back mountain guy, and just a fantastic doctor, and we're just happy he's here, part of the family, and we hope you all get to know him or his wife, who is practicing in our Nanticoke location. Rob is primarily in our Hazleton location. Don't forget about the dynamic duo, Dr. Brendan Connors and Akira Saran. Just had a beautiful little baby. We're so excited for them. Dr. Courtney McCall, exciting. She just got engaged. So I keep on forgetting Dr. Kislin. I really shouldn't. I'll get in trouble. But Dr. Kislin, obviously, our guiding star, still primarily here in our Hazleton location, 1 day a week in Tannersville as well. So thanks again for tuning in, and you know, we hope that you are finding some interest in our discussion about Neurolens, contoured prism, and how it can help to alleviate headache. And so what I wanted to do was talk a little bit about our theory behind that and how it could help some other things too. And so the theory behind this is something called trigeminal dysphoria, which sounds like maybe I just came up with it, right? No, it's not something I just made up. It is a real thing, and actually this phrase, this diagnosis, was coined by a neurologist, and this neurologist was approached by an eye doctor, and this eye doctor said, you know what, I am helping, you know, these people that are having these issues that have not been taken care of or addressed for decades. And at first she couldn't believe it, and then she said, all right, well, I'm going to send you some of my patients that I have a difficult time fixing and treating, and one after one after one after one, they came back to her with resolved or significantly reduced symptoms, and she became a real believer and started to study, why is it that this is happening? What's going on with this prism? Again, this old technology, it's been around since literally Galileo and Da Vinci. How is that something that is now able to help folks with some of their most significant problems? And what they came up with was this idea that the trigeminal nerve, what does the trigeminal nerve do, Dr. Dougherty?
So actually it does a ton for us. The trigeminal nerve is our fifth cranial nerve of 12. It has 3 branches that go to different points of the face. The top 2 branches here kind of go to the eyes, and they're mostly there for sensation. And there's some jaw muscles of, we call it mastication or chewing, that the final kind of pathway goes to. But it does a ton in terms of our overall facial sensation, tension, and sort of muscle movement of our jaw.
Yeah, this is a big nerve that has big implications. And, not only does it innervate the face and the jaw, there's also connections to our meninges, the covering of our brain, some of that distribution that Dr. Dougherty talked about that goes up into the eye area, what's called the ophthalmic branch, also goes all the way back, almost to the base of the skull into the neck area. So just a wide-reaching nerve that has to do with sensation. In other words, what it is and how it is we're feeling. And so, the idea was that, well, if the muscles of the eye are pushed beyond their tolerance, remember that I said they have a tolerance. If they're pushed beyond their tolerance, but still within the tolerance that we're not seeing double vision, okay? I could kind of think of it like a gas gauge. We're going from 0 to empty, or 0 to 100, and we're in green and we're getting in yellow, and red is bad, we're seeing double. We're getting in yellow. And it's straining the system. Those muscles, guess what they're innervated by? The trigeminal nerve. And so the theory is that if we're constantly straining the trigeminal nerve by way of these muscles getting into the yellow, almost getting to the point of double vision, but not quite, that then it sends a pain signal to the rest of the distribution of the trigeminal nerve, which could be interpreted in so many different ways. And another part of it is that it's possible that the trigeminal nerve is being stimulated in another way, either from neck pain or a jaw issue or dry eye, because the cornea, the front of your eye, is also innervated by the trigeminal nerve, that then just a little bit, maybe just at the end of the green or into the yellow, if you will, not real bad strain on the muscles, but enough, it's turning on a nerve that's already been turned on. So, this is something that is sort of new. This whole theory, this whole thought process is kind of new. So, we've heard about headaches. What are some of the other things that you've heard could be helped with Neurolens?
So one thing that I actually have looked into quite a bit, because it almost sounded too good to be true, is like neck pain. And so what we were talking about before is that because of the innervation into the neck, we strain our eyes, and that kind of refers back into the neck. And so now all of a sudden we're straining everywhere. One thing that I always talk about with patients in the room is, what's the level of comfort with your vision? How do your eyes feel? And a good pair of glasses should reduce that strain, and level of comfort should improve. But so one of the things they've really talked about is actually people who have significant neck pain that goes along with things like working too much on the computer and things like that really benefit from this technology, because all of a sudden we're telling everything to relax.
We have terrible posture. Both of us. Yeah. Our posture stinks right now. Let's fix it. Let's try and fix Americans, we have terrible posture. We're slouched over, we have a lot of stress on our neck, and we're staring at our phones or a screen all day. Terrible posture. There is a direct connection between our eyes and our neck. I often tell people, to when they have some pain in their neck, and I talk about their eyes and how their eyes are working and how Neurolens can help. I say, I want you to just relax, and I want you all to do this at home too. I want you to do it too. All right, relax for a second. Now I want you to look all the way to your left and all the way to your right, all the way to your left and all the way to your right. Now I want you to think about your neck as you look all the way to the left and all the way to the right, all the way to the left, all the way to the right. I bet you felt your neck. You actually feel the muscles tense when you do that. And it's partially because we as human beings were evolved to see everything around us. So when our eyes move, your body wants your head to move too. So you could keep a wide view of what's going on around you. But it just goes to show that there's a direct connection there. So when your eyes are moving, your brain is telling your neck that there should be something going on there too. And so again, with this constant strain, and if our eye muscle connection between the two is outside those tolerances and we're constantly straining it, again, you get that signal sent back to the neck. Couple that with degenerative disc disease, couple that with a bad posture, we're turning on a nerve that's already quite sick. And so, you know, when I think about something like this, I think, what do you have to lose? We're suffering from headaches, we have neck or back pain. The other one that I thought was too good to be true was the TMJ.
Okay, yeah.
And again, they're all areas that are stimulated by this trigeminal nerve where we could, again, help to reduce this faulty signal that's going because our eye muscles are out of tolerance and we're straining them so much. Guys, we are so excited to help you out with all of your eye care needs. And if any of you are suffering unnecessarily from headache, TMJ, neck pain, you've had them assessed by your professionals in those respective areas, they still don't have an answer, give us a call at one of our 5 locations. Tell them you want to come in and get a Neurolens evaluation. We'll do a comprehensive eye exam, and we will assess your eye movements and determine whether or not you are a candidate for Neurolens. Thanks for joining us on another Eye Care Today. We'll see you real soon.